Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Before I begin my presentation, I'd like to introduce myself. My name is Mukti di Puspitasari, and I'm a student from Diponegoro University. Today, I will present my presentation about Covid-19. What is Covid-19? Covid-19 is the infectious disease caused by the coronavirus SARS-CoV-2, which is a respiratory pathogen. World Health Organization first learned of this new virus from cases in Wuhan, People's Republic of China on 31 December 2019. Coronavirus are a large and diverse family of viruses which cause illness such as the common cold. The most recent diseases caused by it include severe acute respiratory syndrome (SARS) and Middle East respiratory syndrome or MERS. On 7 January 2020, China confirmed COVID-19 or SARS-CoV-2. It had not previously been detected in humans or animals. The most common symptoms of COVID-19 are fever, dry cough, and feeling tired. Other less common symptoms that some patients may experience include aches and pains, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste or smell, rash on skin, or discoloration of fingers or toes. The symptoms experienced are usually mild and appear gradually. Some people become infected but have only mild symptoms. The vast majority, about 80%, of infected people recovered without the need of special treatment. About 1 in 5 people infected with COVID-19 is seriously ill and has difficulty breathing. Older people or seniors and people with comorbid medical conditions such as high blood pressure, heart and lung problems, diabetes, and cancer are more likely to get more serious. However, anyone can become infected by COVID-19 and become seriously ill. People of all age who experience fever and or cough accompanied by difficulty breathing or shortness of breath, chest pain or pressure, or loss of the ability to speak or move should seek medical attention immediately. If possible, it is advisable to contact the healthcare provider or health facility in advance so that the patient can be directed to an appropriate health facility. People can catch COVID-19 from other people who are infected with the virus. COVID-19 can be spread primarily from person to person through droplets from the nose or mouth that come out when an infected person coughs, sneezes, or talks. These places are relatively heavy. They do not travel far and fall to the ground quickly. People can become infected with COVID-19 if they breathe in the splash of an infected person. Therefore, it is important for us to maintain a minimum distance of 1 meter from other people. These splashes can stick to objects and other surfaces around people such as tables, door handles, and handrails. People can become infected by touching these objects or surfaces, then touching their eyes, nose, or mouth. This is why it's important to wash your hands regularly with soap and clean running water, or clean them with an alcohol-based hand rub. There is no specific treatment for COVID-19. Most people will be able to get better at home in isolation to avoid others getting it. More severe cases may need medical care in hospital. Once a person is infected with COVID-19, their body will usually produce cells or antibodies that remember the virus. We assume these antibodies give the person immunity from the virus, but it isn't currently clear how long immunity lasts. As of 24 April 2020, no study has evaluated whether the presence of antibodies to COVID-19 confers immunity to subsequent infections by this virus in humans. You can reduce your risk of becoming infected or spreading COVID-19 by taking a few precautions. First, wash your hands frequently with clean running water and soap or an alcohol-based hand rub. And the second, maintain a distance of at least 1 meter from other people. And the third, avoid going to crowded places. The fourth, avoid touching the eyes, nose, and your mouth. And then, stay home and do self-isolation even if you only have mild symptoms such as cough, headache, and low-grade fever until you recover. Ask someone to bring you supplies. If you have to leave the house, wear a mask to avoid spreading it to other people. And the last one is, stay up to date with the latest information from trusted source. I think that's all my presentation. Thanks for your attention and wassalamualaikum warahmatullahi wabarakatuh.